One of the strengths of our program is the many different practice sites our residents work in at the University of Washington Family Medicine Residency. Our residents have an opportunity to care for patients in a rural hospital, a smaller community hospital, a Level 1 trauma center, and a quaternary care center for the WAMI region. This contributes to our broad spectrum training, preparing our residents to work in any setting following residency.
Whether it's like UW, which is really like a quaternary care center where people are going to have transplants, or if you're interested in like Harborview, which is the trauma center for 5 states. We have a world-class children's hospital, Seattle Children's, and we work at a VA. And we have UW Northwest, which is a community hospital that has a lower acuity inpatient patients. And so I just really love that we get to work all sorts of different places.
The University of Washington Neighborhood Clinic at Northgate is one of our residents' continuity clinic sites. Here, our residents provide the full spectrum of family medicine alongside our faculty. There are several specialty clinics where residents will spend time seeing patients, including a reproductive health clinic, colposcopy clinic, sports medicine clinic, travel medicine clinic, psychiatry clinic, and neonatal circumcision clinic. We have an integrated behavioral health program with an on-site counselors, psychologists, and psychiatrists. We also have on-site nutrition counseling and social work, as well as an on-site lab and X-ray. We perform various procedures in the specialty clinics and within our continuity clinics as well, including dermatology procedures, women health procedure, and joint injections. Harborview Family Medicine Clinic is the continuity clinic site for our residents in the Harborview track and for the first year of the rural training track. It is a hospital-based residency training clinic serving vulnerable and marginalized patient populations. The clinic staff and team reflect the racial, cultural, and ethnic diversity of our patient population. Care provided in the clinic includes that for refugee and immigrant communities, people with comorbid mental health illnesses and substance use disorders, trauma survivors, and people with housing and food insecurities. Many of our visits at Harborview are interpreted. Spanish, Mandarin, Vietnamese, Somali, and Arabic, in addition to English, are some of the most common languages spoken by our patients. Valley Community Health is the continuity clinic for our rural training track residents in the second and third years of their residency training in Chelan, Washington. It is a federally qualified health center that has been serving North Central Washington for over 30 years. The clinic is a safety net provider for many marginalized and underserved communities in the area, including seasonal and migrant farm workers. The University of Washington Medical Center Northwest is the location of our family medicine service. The service is run by our family medicine senior residents and is staffed by our department faculty. Residents will care for adult medicine patients, OB patients, and newborns on our family medicine service and will rotate on this service during all 3 years of the residency. They will also do rotations in OB, general surgery, and cardiology at Northwest Hospital. UW Medical Center Northwest has a community hospital feel, with the benefit of being affiliated with a larger academic community. The University of Washington Medical Center Montlake is one of the world's foremost academic health centers. It is a research hospital providing complex multidisciplinary care to patients. Residents will rotate here during their OB, ICU, and emergency medicine rotations. As the #1 hospital in Washington, the University of Washington Medical Center Montlake is the referral hospital for complex medical, surgical, and obstetric cases from throughout the region. Residents will rotate at Harborview Medical Center during their inpatient medicine, trauma, and emergency medicine rotations. Harborview is a mission-driven hospital that provides comprehensive care to a diverse patient population from throughout the Pacific Northwest, including the most vulnerable residents of King County. It prioritizes care for patients who are uninsured or underinsured, victims of domestic violence and sexual assault, people incarcerated in King County Jail, and people with mental illness or substance use problems, as well as those who require specialized emergency, trauma, or burn care from throughout the region. The Seattle VA Medical Center is located in South Seattle. Residents have the opportunity to rotate at the VA on their inpatient medicine and dermatology rotations.
I think my favorite hospital to work at so far has been the VA. The patient population is great. It feels like it's a place it's really great for learning. It was actually my favorite place to work and learn.
Seattle Children's Hospital. Residents rotate at Seattle Children's Hospital during their pediatric inpatient and emergency medicine rotations. They also can spend elective time in one of the various pediatric specialty clinics, such as cardiology, adolescent medicine, and gender clinic.